Thank you. And I first want to thank our organizers, Maria and George, for putting this program together and for connecting us internationally during what has been a very challenging year. So thank you, and thank you to Chiara as well. So to begin, I know that many of you are aware that this lecture series focuses on the areas of medicine and technology, technology and medicine in the ancient world. Today, I plan to focus on an area that is admittedly very low tech. It's perhaps the farthest from technology, and that is the medical interaction between doctor and patient, the conversation or dialogue between them. So in fact, doctor-patient interactions, even today in our technology-enhanced world, are remarkable for being low tech. As the author Danielle Ofri has noted in a recent book called What Patients Say and What Doctors Hear, it's about the clinical encounter in modern medicine in the examining room. She notes that despite modern medicine's infatuation with high-tech gadgetry, the single most powerful diagnostic tool is the doctor-patient conversation, which can uncover the lion's share of illnesses, as she goes on, even more than expensive procedures and so forth. So if you were an inhabitant of the Roman world, you had a lot of choices when it came to seeking medical advice or cures. You could choose from physicians who saw patients in a way that was broadly similar to our physicians today. You could choose from a religious approach, a priest perhaps at a temple of Asclepius. You could consult a pharmacist in a shop or a stall, and depending on the health issue and the practitioner's approach, you might receive any number of treatment prescriptions, perhaps a diet and exercise plan, perhaps a ritual in a temple, perhaps a medicinal plant or an herb, and less commonly, because it was risky, a surgical procedure. So depending on where you were in the empire, west or east, city or village, your options might differ, but they were all by definition involving healthcare interactions. I'll be focusing narrowly on one of these types of interactions today, that between physicians and patients, and I will narrow it further to look at a couple of treatises, texts by one physician, Rufus of Ephesus, on patient care, because Rufus provides texts that give us an opportunity to inquire into how one Roman doctor understood the patient's role in the medical encounter. Rufus is noteworthy because he's intent on considering the whole patient, to providing what is termed a patient-centered approach. However, as we'll see, there were obstacles to putting his plan, his aspirational plan, into practice, especially for female patients, as we'll see. As we consider the obstacles that Rufus may have faced in his work, we'll have a chance to consider the social context in which he was writing, the intended audience for his texts, and even the pressures that might have been placed on him when he tried to implement a patient-centered approach for female patients. But first, let's consider how Roman physicians tended to view their patients, a couple of questions we might ask. For example, we might wonder, to a Roman doctor, was the ideal patient an active participant or more passive in the process of care and treatment? Was the patient viewed as capable of offering valuable insights, as potentially assertive, or offering a narrative that could help the physician build a knowledge base? Or on the contrary, was the ideal relationship, as envisioned by physicians, more of a top-down dynamic, with the doctor as an all-knowing authority figure and the patient expected to be guided and to be deferential to his expertise? So those are some important starting questions. And on this topic, it's important to note that scholarship investigating evidence for the dynamic between physicians and patients in antiquity has been flourishing, particularly in the past 5 years, 5 to 10 years. The list here offers a few examples, and I'm grateful for these lines of inquiry that I'm following today. I hope to contribute to some of them. Melinda Letts especially has recently given valuable attention to Rufus of Ephesus and his handbook for patient care called Medical Questions, which we'll look at in a moment. Others, including Susan Mattern and Vivian Nutton, and the edited volume on approaches to the patient in the ancient world are some other further reading sources here. In fact, we know that ancient physicians had a range of attitudes toward patients. Take Galen of Pergamum, the best known physician from the Roman Empire, whose career was flourishing a couple of generations after Rufus. Galen was quite proud of his skills and expertise, though he possibly didn't shine when it came to his bedside manner. You can think he was sort of a Sherlock Holmes type figure, perhaps. But nevertheless, he was incredibly successful. And part of the reason that he viewed himself as successful, in his own words, is that he insisted on obedience from his patients. They had to follow his advice. In a treatise that he wrote called On Examinations, by which the best physicians are recognized, and this text survives only in Arabic. It doesn't survive in Greek, actually. Galen has harsh words for the physicians in his purview who don't act, he thinks, authoritatively enough in the clinical encounter. He says, in view of their, that is doctors who pander to patients, their inability to ensure anything valid in therapy, they never request their patients to obey and follow their lead. Instead, they debase themselves to the status of slaves of their patients. The doctors, that is, obey and assist their patients in fulfilling their desires. And in doing so, they become wicked slaves whose services are useless and indeed harmful. So strong words there. And in another example, this time in a commentary that Galen wrote on case histories from the Hippocratic epidemics, Galen notes that the doctor should want to be viewed by his patients as a wonder worker, as a true expert with exclusive knowledge that he sort of guards and uses to give off an image of competency and success. So here Galen describes his own take on the doctor-patient dynamic, saying if the doctor inquires about things that have already happened and things that the patient and his companions already know, they immediately admire him. And similarly, they condemn a doctor if he asks about anything that is the opposite of what has happened. If in the middle of the question and answer process, he happens to mention some of the things that have befallen patients before they tell him themselves, he is marveled at. So those are some examples from Galen's writings. But to turn to Rufus, he was a practicing physician, prolific author as well, in the 2nd century, a couple of generations before Galen. He was active during the reign of the Emperor Trajan, as far as we know from the Suda. And he lived at Ephesus, where he seems to have established his career and perhaps went on to work at Rome, although it's hard to know. We can deduce what his professional situation was like from other things we know about the city of Ephesus. It was affluent. It had become an intellectual center with a flourishing medical profession. And Rufus wrote on many medical topics, on anatomy, on disease, mental health, and regimen. And regimen are the diet and exercise plans that have a therapeutic function, one of which we'll look at. Many of Rufus's texts survive only in partial form today. You can see a few examples listed here. I've highlighted the two that we're going to focus on. The first is Medical Questions, which is the handbook on interviewing patients in a clinical encounter. The second is The Regimen for Young Girls, a diet and exercise plan for a special group of patients, that is, teenage girls. So on this map of the empire, 2nd century, you can see where Ephesus was over in the east. Of course, there were other centers for the medical profession in the east at Pergamum, at Antioch, at Alexandria. And some physicians, including Rufus probably, could gain quite a high profile. Ephesus was prosperous enough for Rufus to make his entire career there if he wanted to. because it had a vibrant intellectual community where physicians formed their own professional organizations based on their sectarian affiliation or sort of broadly speaking, their schools of thought with their own theories about how the body worked, ideas about how best to diagnose, treat disease, and they tended to affiliate with others who shared their ideas about how systems of the body worked. You'd have leading doctors debating spiritedly with each other over theory. They were offering public medical demonstrations, and they were competing to win the attention of aristocrats in the city, some of whom were highly educated and knew a lot about medicine. Actually, they were non-specialists, but they were quite knowledgeable. As Vivian Nutton has observed, there was a special way in which the knowledge of non-specialists and the dynamic between them and physicians could lead to a kind of perpetual search for novelty, in fact, among physicians who were trying to appeal to the wealthy locally. And healers' false statuses in the medical marketplace in the Roman Empire were very active in this way. More on this in a few minutes. But from a prolific author like Galen, for example, in Pergamum, nearby Ephesus, we hear a lot about disputes related to medical theory and the competitive dynamic among doctors. You might have heard of Methodists, empiricists. These were some of the sectarian affiliations of doctors. They participated in esoteric debates, and they must have sort of created a chaotic atmosphere for medicine at this period that was somewhat confusing to patients who were trying to make sense of all the options. Even an educated layman could be overwhelmed by the options. But nevertheless, despite emphasis on theory at the top, in the top echelons of practitioners, all physicians at some point, we can imagine, devoted thought to these practical issues of clinical care related to the quality of the interaction between the patient and the physician. The Hippocratic doctors, centuries before Rufus, had always, of course, considered the right way to observe patients, to learn about their symptoms, to make the correct diagnosis and recommendation for treatment. So this sort of raises the question of how the medical community wrote about this issue. And in this regard, Rufus is particularly interesting because he wrote Medical Questions, a handbook advising doctors on how to interview patients thoroughly while examining them. Before diagnosing them, before treating them, the doctor should talk to them. It's really the only handbook of its kind to survive from the Roman Empire, so it's special. And in this handbook, Rufus urges doctors to view patients as collaborators in the medical encounter. Doctors should interview patients before diagnosing them. Patients should be directly questioned and listened to carefully, viewed as individuals with their own individual bodily constitutions, their own individual predispositions and habits, not considered as a kind of generic part of a large group with syndrome A or condition B, strictly based on previous cases, not thought of just as a body exhibiting symptoms to be read or decoded. In that spirit of viewing the patient as an individual, Rufus stresses that the physician cannot attain what he calls complete and accurate knowledge about a given patient just by relying on the reporting of a third party or simply by taking a record of symptoms. So how did this viewpoint on doctor-patient collaboration compare to other perspectives? Well, we saw the example of Galen. We can sort of review this, where Galen is intent on having a doctor-patient interaction that results in admiration and wonder from the physician. If Rufus, we'll see, sort of urges doctors to be humble in the face of what patients know, patients are potential collaborators, Galen sort of espouses the opposite. The clinical encounter is an opportunity to impress the patient, to get him to view the doctor as unparalleled and potentially very powerful, right? Elsewhere, in fact, as Susan Mattern has discussed, the patient is supposed to, in Galen's view, even go so far as to view the physician as a god, because in Galen's view, that's really the only way a patient will obey his doctor's orders. You could take also Callimachus of Bithynia, who practiced a couple of centuries before Rufus. Rufus mentions Callimachus in the handbook, Medical Questions, and Rufus sets his own approach against Callimachus's as a contrast. He actually says, I'm amazed by the physician Callimachus, who alone of earlier doctors denied the need to ask questions about illnesses. He claimed that signs were enough to indicate both the condition and its cause and should preferably be used as the basis of all prognosis and treatment. Callimachus said there was no need to ask even about the immediate causes of illness, on the grounds that the physician had no need to learn anything from these if he considered carefully and accurately the signs that accompany illnesses. So for Callimachus, at least according to Rufus, as he reports it, the physician is primarily observing a body, not listening to the viewpoint or the story of the patient. Callimachus may not come across as sort of needing to be marveled at in the way Galen comes across, but he still seems to be in favor of a top-down model for interaction between doctor and patient. Meanwhile, as Rufus frames it in Medical Questions, the interaction for the physician is about respecting the layman's knowledge. You must ask the patient questions, he says. And here the perspective is that there is value in the knowledge of the layman, even if it is not entirely expert, even if it is not entirely precise in its description. Patient testimony could be especially important, of course, because at this time, the interior of the body was largely inaccessible. Dissection, vivisection, taking apart the human body, looking inside was not, as far as we can tell, was not commonly performed. So in Rufus's view, it's not really enough to take in a bystander's point of view. It's not really enough just to look or to fall back on a set of assumptions. The patient's own account is important. What sorts of questions would the doctor ask then when interviewing the patient? Well, this is what Rufus goes into in the text. And in another portion of Medical Questions, Rufus talks about the benefit of learning about all the patient's habits, including with food and drink. As you can see here, he says it's necessary to learn actually from the patient how each item of food and drink affects him, not to overlook any experience he may have had of medicine. And he goes on to say, got to ask if he's had a good appetite, if he hasn't, and ask about his favorite foods, the familiar foods for him. People can consume familiar foods, he says, more happily than those that otherwise might seem to be the best. Familiar things are greatly preferable, whether one is sick or well. So this is kind of his approach. It's one of comfort and kind of learning about foods and so forth. And keep this in mind, we'll come back to the idea about foods in a minute. This is an example, though, of the circumstances, the individual characteristics that doctors should ask the patient about in Rufus's view. So as Melinda Letts has recently put it, what Rufus is keen to emphasize to the audience for his handbook, and the audience may have been medical students, maybe practicing physicians who were interested in reading about clinical care. Rufus is keen to emphasize the limits even of a specialist's knowledge. As she says, Rufus is stressing the need for the doctor to consider both the external circumstances and the individual behavioral characteristics of a patient, but he's less interested in providing an exhaustive list than in emphasizing the limits of the doctor's knowledge and the consequent necessity of questioning the patient. So these are some guidelines from Rufus, and these are examples from the handbook, the instruction manual. But my question to go on from here is whether there were limits to this patient-centered approach that Rufus ran up against. So we've seen that Rufus does characterize the patient as having authority in the doctor-patient interaction. And when patients spoke, doctors were supposed to listen before diagnosing, before treating, before drawing conclusions. But there might have been moments when even Rufus did not question his patients thoroughly before diagnosing something for them or prescribing something for them. Were there moments when he relied on generalizations rather than on learning about them as individuals? Well, yes, there were moments. And to see one of those moments, we can look at another treatise by Rufus. It's called The Regimen for Young Girls. It diagnoses and treats patients not so much as individuals, but as a group. It treats them en bloc without a personalized approach, without a tailored approach to their individual sort of constitutions. As we noted earlier, Rufus wrote a lot on different subjects. And this does give us a chance to sort of see how his ideas carry across from one text to another. The Regimen for Young Girls is a very different text from Medical Questions with a different aim. And so before we look at a couple of passages from that text itself, there are a few things to know about what it is and what it purports to do. It prescribes a diet and exercise plan for all girls at puberty. Around ages 13 or 14 is when it's supposed to be implemented. And it involves some dietary restrictions and some particular forms of physical exercise. So in the text, girls appear as passive figures. They're called parthenoi, sort of maidens. They're the recipients of care that is prescribed by the physician, not with any real regard for much more than that. If there is a doctor-patient interaction lurking behind this text that motivated it, we don't get much of a sense of it. The text tends to just offer prescriptions for this group. Girls in the text are told, or the reader is told, that girls have a potential affliction that is caused by their physical development. It starts at puberty, and it leads them to sort of become desirous of pregnancy, of sexual activity. And this is interesting because overall, as I'd like to sort of argue, it shows that even physicians like Rufus, who show us that they have high ideals for collaborative dynamics between doctors and patients, could find themselves under pressure that did cause them to fall back on assumptions. So let's look for a moment at what the regimen prescribes. One thing it prescribes for girls is dietary restrictions. Here is a passage from it, and it says, when maturity approaches for girls and growth is just short of its limit, and out of modesty, girls don't play childhood games anymore, then one must pay more attention to their regimen. Their consumption of food should be regulated and measured, and they should not touch any sort of meat or other very rich foods. So this is a prescription to be implemented at a life stage when this group of girls is believed to need it. It's a change in diet, including, in addition to taking away meat from the diet, there's also a part of the prescription that suggests taking away wine and replacing it with water for girls, because as Rufus says, water drinking helps with moderation, but wine makes girls rather licentious. So in its pairing of oppositions, water and wine, moderation and excess, I find this part of the prescription pretty interesting because the statement sort of has the feel of a proverbial saying, a kind of traditional, popular, instructive saying, not so much the feel of specialized medical knowledge. Indeed, the association of female wine drinking with licentiousness is found in a number of literary works from the early empire that are roughly contemporary with Rufus, a little before his time. Valerius Maximus's collection of moralizing anecdotes includes a bit about licentious women and their wine drinking and their husbands who have to control them. And Alice Gellius includes in his compilation of facts and stories some similar anecdotes. This is interesting because it assumes a kind of need for change in diet based on age and physical growth stage in a way that seems somewhat at odds with medical questions, which promoted staying consistent with an individual patient's familiar foods and diet as best for them, right? Or that they'll be most comfortable with that. So interesting. And in addition, the sort of girls are supposed to take part in exercise. There are specific forms of exercise to keep girls healthy, and Rufus recommends a number of them that you can see here. There are long walks, some running, some exercising by rolling in the dust, the chorus with its singing and dancing, and also playing ball. So it's a range of permissible activities that's pretty broad. It's not overly restrictive. These are mild, sort of leisurely sports. What you note here in sort of long walks should be prescribed, et cetera. You notice that it's the caregiver or the parent, it's a third party who's being addressed here, not a young female patient herself. It's clear enough that this regimen is going to be sort of imposed on a girl or kind of implemented by someone else. She wasn't so much the individual offering insight into her condition for the physician or what was wrong, if it indeed anything was, but she needs others to guide her on what her body needs, including the authoritative physician. So in another passage, sort of in the text, Rufus does say, this is also for a purpose. We want girls to exercise so that the body remains feminine, not too much exercise though, because this could cause it to take on a masculine appearance. So this sort of opens our eyes to the potential for physicians to be influenced by concerns about sort of gender norms and expectations, about what girls should look like, as well as how healthy they should be. So the goal of this regimen is for health as well, and the point is to limit a girl's weight gain, which is thought to limit the development of sexual desire before she can be placed into marriage. As our doctor says, for the more quickly a girl puts on weight, the more quickly she becomes nubile, and the more quickly her desire for sexual activity and childbearing is aroused. It's because of this that the law prescribes marrying young girls to older men. So girls are assumed to be especially sexually desirous at a young age, potentially. Their modesty needs to be guarded before they can be married off to older men, no less, here. So this block of patients are treated as fairly uniform in their health situation, at least partially because there are social concerns intertwined with medical concerns here. And to an extent, medicine is being pushed into service to provide a therapy to prevent, sort of girls being led astray, perhaps before marriage and so forth. It's as much a social as medical concern. Now, this isn't to be overly critical of Rufus here because his intention and the potential outcome for girls for their health, it's not all bad, right? If he's limiting dietary excess, promoting physical fitness of a young teenager in order to keep her from becoming pregnant at a young age, then that does protect her health and safety. Childbearing, even now, is very risky for young teenagers, and in the Roman world in general, childbearing was very dangerous indeed. So if you're Rufus, you might say that you recommend this regimen for all girls, whether they have anything wrong or not, because the real concern is that they should go on to become healthy mothers, healthy wives, and he does express concern for their health. Nevertheless, this is not a person-centered necessarily approach. Girls are passive figures who are the recipients of care provided by the physician without discussion of whether they actually need these restrictions. And this is in contrast to the statements made in medical questions where communication with the patient is viewed as so important for diagnostic accuracy. Talking to the individual patient is the only way to come up with a proper treatment. So Rufus doesn't mention talking to any young female patients or questioning them. And to conclude today, I'll just offer a few thoughts on why that was. Female patients were a special challenge for the doctor. And here I've sort of outlined a few of the reasons that young female patients could make the patient-centered approach difficult. The first involves girls' voices. Unmarried girls in particular, because of concerns about modesty, were best not seen or heard in general, and they would have had to be on guard around adult men who posed a threat to their modesty. But this expectation of silence does seem to have pertained in some cases to adult female patients as well. And occasionally a practitioner could use the customary silence of a woman as an opportunity to showcase his own intuition and diagnostic skills. So again, if we just think of Galen and his treatise, you might know the treatise on prognosis by Galen. He shows in that treatise that he needs no verbal account given from one of his female patients who is suffering, as he says, from psychological symptoms. He's able to diagnose her with lovesickness simply by detecting her racing pulse when she's in the presence of a man she desires. So in short, the customary silence of a female patient um, was fairly well known. It's sort of it appears in accounts by medical writers, and it could be turned in certain professional situations to the advantage of the physician. At least it is in the case of Galen's on prognosis. The second sort of issue is that in general, medical encounters in the Roman world were often carried out in full view with patients surrounded by their friends and family, making it more likely that a girl would have people speaking up for her or their concerns being voiced as well as hers. And finally, in the struggle for prominence in the medical profession, an issue was that doctors often had to seek out wealthy families, wealthy men as their patrons, which could involve feeling pressured to tell these men potentially what they wanted to hear about their daughters and wives. And this brings us back to the issue of context and audience, and namely, who were the readers of the regimen for young girls? It's hard to track the circulation of medical texts in the Roman world in general, and the regimen for young girls is no exception. But given that it doesn't focus on technical matters or clinical interactions, it is possible that this was a text targeted to, maybe marketed to, promoted not only to healthcare providers, but to parents. Those who had daughters of marriageable age might be looking to do things at home to ensure that their daughters were healthy, well behaved, before they could participate in the marriage market. We do know that Rufus took an interest in general in audiences beyond specialists. He wrote a text on medicine called For the Layman that's now lost. It was for an educated non-specialist audience. And we know that educated aristocrats would have had acquaintance with medicine, as I mentioned before. The author Alice Gellius remarks that an educated layman should not be so ignorant as to confuse veins and arteries. He talks about this. And Plutarch, who was likely a contemporary of Rufus, in his text, The Symptotic Questions, where he depicts a dinner party conversation, he portrays physicians and non-specialist guests having an animated debate about medical topics, where medicine sort of goes outside the bubble of the specialized world and into a conversation more widely. So it is possible that this text could have circulated to a wider audience. As for this other question that sort of lurks behind this too, what about female physicians and how they might have viewed all of this? It's really hard to say. Our evidence is fragmentary. Our knowledge is fragmentary for female physicians, but there is one tombstone I wanted to draw your attention to. This is the tombstone of Primilla. We would really be interested to know her point of view on all of this. You can see her husband made this for her, her husband Aphtharus. She was a physician who died when she was 44, and she was married for 30 years to Cocceius Aphtharus, which indicates to us that she was married when she was 14, right, around this age that the regimen for young girls was written for. So she was part of the system. We'd be very intrigued to know what she would have thought about this text of his and about how the female patient should be heard. So to conclude, Rufus really focuses on how the patient's perspective can help the doctor build his knowledge, his understanding. And in some ways, that's interesting enough. We might compare Rufus's sort of really fairly progressive view in medical questions with training programs in medical schools today that focus on improving the clinical encounter and increasing physician empathy and engagement with the patient. An example is Columbia University's program in narrative medicine, whose goal is to enable patients and caregivers to voice their experience, to be heard, to be recognized, and to be valued, improving the delivery of healthcare. Yet, in Rufus's world, and in ours as well, gender and status concerns were obstacles to high quality patient care. Some patient voices were clearly quieter than others. Some of them were even silent, with third parties doing the negotiating that resulted in diagnosis and treatment. When it came to girls, for example, Rufus did not find it easy, perhaps, to follow the ideal person-centered approach to patient care. Placing medical questions alongside the regimen for young girls allows us to see a physician who might have been pulled between two different aspects of his career. On the one hand, he was a conscientious practitioner, striving to be empathetic clinician, a good listener, treating his patients as individuals. On the other hand, he worked in a hyper-competitive field. And as he fought to gain the trust and support of patients and patrons, there was no doubt that he might be socially, reputationally rewarded by appealing to the habits and the tastes of an aristocratic audience. That is, if he told parents of girls sort of what they wanted to hear. These very different parts of professional life were left to doctors like Rufus to reconcile in their clinical encounters. And to me, that's fascinating because inconsistencies like this can really reveal pinch points in a culture. In this place, an ideal is promoted in one context, but isn't put into practice in another. And when young female patients are involved, we might go so far as to say that Rufus follows more of the path, perhaps, that Galen laid out, in which the ideal patient, or perhaps more to the point, her parents, will admire him. Thank you.
I suppose it is my turn now. So first of all, I would like to thank Maria and George for organizing such a great event, and Lauren, of course, for her insightful paper, which I found very thought-provoking. I would like to draw particular attention to the last section of the paper, which I found fascinating since it discusses Rufus's methodology as medical practitioner as being the result of a plethora of different factors, including social and political aspects, as well as previous traditions. And it is precisely from Rufus's predecessors that I would like to begin my response. I would like to focus on the text on slides 15 and 16, or 17, I suppose, more specifically on the claim that when girls are older and their growth has stopped, their consumption of food should be moderated, with particular regard to meat and rich food, and that a moderate exercise should be prescribed, such as walking, running, rolling in the dust, or the mild activity which is typical of the chorus, but without excess, so that the girl might not take a masculine appearance. Now, Rufus's theories appear to be the result of a pastiche of Hippocratic notions on which more traditionally Roman beliefs have been superimposed. Latin literature provides examples in which girls who exceeded the norm in food and drink tended to adopt a masculine attitude, both with regard to exercise and aggressive sexual behavior as well. I'm thinking, for instance, of Marshall Epigram 767, just to give an example. And this will suggest the existence of a common cultural ground from which Rufus seems to be drawing. I argue, however, that we can also detect some strong Hippocratic influences in Rufus's recommended regimen for young women hitting puberty. The first striking argument which can be made is that Rufus seems to base the whole lifestyle of young female patients around the main event of their sexual maturity and reproductive function, which is consistent with a general view found in Hippocratic gynecological treatises, where diseases of women are mostly linked to and caused by their sexual organs. And of course, in Imperial Rome, the Hippocratic corpus was the referential core for physicians to develop their theories about girls' health. So if we examine the text more closely, we can detect some even more specific resemblances between Rufus's arguments and the Hippocratic treatment of young unmarried women's diseases. In the Hippocratic treatise on diseases of young virgins, the case discussed seems to be the exact same which Rufus is seeking to prevent. So young women in the age of marriage are afflicted by several symptoms which go from numbness and derangement to restlessness and even suicide by jumping in wells or in the most severe cases, hanging. As the author of the treatise specifies, this disease has a precise cause: food and growth of the body. so diate sitia caeten auxesin tu somatus. But what does this mean exactly? In the Hippocratic and Aristotelian system, food is believed to be the direct origin of blood. In other words, an excess of food causes excess of blood. Thus, in the case of the Hippocratic diseases of young virgins, the idea is that more blood is flowing to the womb on account of food and the growth of the body. The mention of growth could be connected to the idea that a girl's body has to be opened up inside so as to allow menstrual blood to be collected before it moves to the womb for menstruation. In another Hippocratic text on generation 2, it is argued that these internal channels through which blood moves to the womb are narrow and blocked in girls and need to open out and become wider in the process of growth. Thus, for the Hippocratic writer, at the core of the problem is not the actual size of the girl's body, but the amount of blood which it contains. If the girl has reached the stage of maturity sufficient to allow her blood to reach her womb, but the mouth of exit is not open, then the blood cannot flow out of her body. And when the blood reaches the womb and cannot flow out, it moves instead upwards to the heart and diaphragm, and copious quantities of blood clearly cause much greater ailments. The Hippocratic author further specifies that release from this disease comes when nothing prevents the discharge of blood, and as a consequence, he urges young women suffering from such a condition to cohabit with men as soon as they can. For if they become pregnant, indeed, they do recover. Now, Rufus seems to hint to this disease as well when he recommends that girls approaching menarche should avoid rich foods, such as meat, albeit the remedy he prescribes is aimed at preventing the disease and therefore the need for sexual intercourse. The assumption is that richer food will produce greater quantity of blood. A reduced amount of it would reduce the risk of the body becoming overfilled with blood and as a result developing the disease. So Rufus's prescribed diet then would ensure that virgin girls remain so until their marriage. Now, the issue of food and blood and what they contribute to the body is a particularly complex one, especially when it comes to the female body. In Aristotle, blood is the agent of nutrition, and semen, menstrual fluid, and milk are all forms of surplus nutriment. As Aristotle claims in Generation of Animals 2:7, an excessive amount of flesh in the body causes infertility both in men and women. If their bodies are too well fed for fat, this implies that the residue, toperitoma, produced from blood has been used up to benefit the growth of the body. So as a result, there is not enough residue left, which can become menstrual fluid in women or sperm in men. On the contrary, an excessive amount of residue is equally detrimental, since it makes the women suffer severe discomfort during gestation. This happens particularly to sedentary women, as Aristotle states in Generation of Animals 4:6, as opposed to women who are used to hard work. The latter have much less residue. Indeed, in their case, even gestation is not obvious, epidalos. Whereas the former collects an excessive amount of residue within the body, which cannot be expelled, also due to pregnancy and lack of menstrual discharge, and as a result causes swelling and pain. Now, Aristotle's praise of hard work for women during pregnancy is interesting, as it does not seem to be consistent with what is found in Hippocratic treatises, where exercise is either recommended with moderation, as in Epidemics 662, for instance, or even banned as detrimental, insofar as it was believed to cause uterine displacement, as we read, for instance, in Diseases of Women 1:7 and 2:36. So the first question which I would like to ask you is, to what extent do you think that Rufus's arguments were also influenced and built on Hippocratic and Aristotelian conceptions of the female body? The second point of my response regards the more general treatment of diseased girls whose voice as patients we do not get to hear in Rufus's works. As you illustrated very clearly, Rufus's medical approach towards young women diverges from his usual practice in that instead of acknowledging the authority of the patients, he appears to be going by the handbook, thus generalizing the whole category and the relevant medical issues which might befall on it. More specifically, there is one point which I found particularly interesting, that is the girls' puberty and readiness for marriage are also signaled by the fact that they stop playing with their childhood toys out of modesty. The Greek words which Rufus uses are eupodaidos, meden, ton, paidikon, eti, paizosi. So I was wondering whether this reference to their toys can be hinting at the dolls with which young Roman girls used to play as part of their preparation for womanhood. According to a Greco-Roman custom, young women traditionally donated a bone, cloth, or ivory statue to a goddess, typically Aphrodite or Venus, before getting married. Now, despite the scant literary evidence, the numerous archaeological finds dating from the 2nd century BCE to the late 4th century CE have allowed scholars to gain a clear idea of their general appearance and, more importantly, their function. Despite being toys generally used by young girls, these ancient dolls did not reproduce the features of a child, but rather those of a sexually mature and good-looking young girl. So, although the ludic experience was prima facie similar to our modern idea of playing with dolls, dressing them with clothes and accessories, combing and dressing their hair, the function of the doll was profoundly different. Donating one's pupa to Venus signaled the rite of passage from maidenhood to womanhood, the sacrifice, as it were, which young quelle were told to perform as part of their figurative death as young virgins and rebirth as married women, thus signaling that they were leaving behind their toys and therefore childhood. So this custom, I argue, is particularly revealing of the ancient Roman attitude towards the young female body in a twofold manner. On the one hand, as girls familiarized with the main features of the mature female body by interacting with the dolls, it shows that attempts to explore the body were diverted towards the artifacts, rather than experienced and investigated personally. Thus, the lack of young female patients' voices in Rufus's works can also be explained by the fact that young girls were not used to imagine their body in terms of personal characterizing features, but rather as a generalized model to which they should have adhered. On the other hand, this seems to be consistent with a generalized discussion, which we read in Rufus's works, where the female body is treated in a standardized, almost idealized manner. Physical exercises, which are mentioned later in Rufus's text, seem to involve a more hands-on type of approach instead, which is not only based on theory, but also on actual practice. So the text seems to suggest that this more practical type of approach happens at a later stage when the girl has gradually become aware of the newly acquired features and needs of her mature body, and is preparing herself to see and experience in real life the functions of those bodily parts which she had previously learned about through the body of the doll. So my second and final question, Lauren, is whether you consider this tradition to be consistent with Rufus's more detached approach towards young female patients. Thank you.
Well, these are wonderful questions, really thoughtful, and thank you so much. Really very engaged with Rufus and his predecessors, giving a lot to think about. And to your first question, about the background for this and the influence of earlier theory on Rufus's own approach, he's heavily influenced by the Hippocratic regimen for young girls. I think you're absolutely right. And at the same time, one passage that I didn't point to in the talk today, but that is very interesting in the regimen for young girls, is where Rufus says that he really thinks that in contrast to earlier prescriptions, it's better for girls to marry at 18 and to wait for 4 to 5 years after menarche because it's safer for childbearing. And so he does seem to have, as you're pointing out, the Hippocratic ideas of accumulation of blood being related to food intake and having that, an excess of blood being unhealthy. He adheres to that, that it can overheat the body, to exercise too much at a kind of precarious stage of life. He seems to inherit that as well from Hippocratic thinkers. But he departs from them and diverges from them in recommending that girls don't start cohabiting right away at menarche with a male partner and start bearing children, but that they wait. And in fact, in that passage, and I know you work on literary texts, Chiara, and so forth, and the interface, he actually, Rufus actually quotes Hesiod, and he says, it's actually Hesiod who says, let a girl sort of be mature 4 years and let her be married in the 5th year. And Rufus says, we might think that's an old-fashioned way of looking at things, that she should wait, but that's what I recommend. We've seen it. And so the kind of interesting thing, and again, I hadn't really thought about it until you prompted me to think more about it, so I thank you for this, is that actually, in the case of girls, sort of generalizing or viewing them en masse as a group, as a category, is a good thing for this group of patients, because only by observing the dangers of early childbearing as in a group kind of, across many instances, I think that Rufus is able to draw the conclusions that he does, that, that they should wait for childbearing, whereas individual cases might not have given him the information that observing the kind of consequences of early childbearing in a group of patients kind of did. So that's it's really interesting. And, for the dolls and the sort of dedication of dolls and the giving up sort of, as you pointed out, the games of childhood. Initially, I had thought of those as sort of co-educational childhood games, the ones that they were playing with boys. And so that there started to be gender segregation at puberty, and that might have been part of it. There's, as you said, that all of the artifacts, the dolls that remain that show mature female features, physical features that girls played with, it seems perhaps true. Burials like those of the tomb of Creperea Trifina, where there's the ivory doll that was discovered with mature female features in a maybe an older teenager's sort of burial, suggest, at least we can't know conclusively, suggest though that perhaps this belonged as a kind of prized toy for a girl. And I love how you're mentioning too that these could have a kind of didactic function, right? And teaching sort of girls about the body along with women's knowledge, and conversations with older female members of the family. So to see whether, I was wondering whether you were, in your question, were you wondering whether Rufus's statement about childhood games and toys relates to those particular dolls, Chiara, or?
Yes, actually, my final question was a bit more focused on the general approach of Rufus as well, whether we can see consistency between his approach and this habit. So to focus, as you said, exactly on the doll rather than on their own body.
I think that's right. Yes. So that seems interesting, especially as you're pointing out, if girls were expected to sort of learn about their bodies from this type of item, this object that was in their possession, and that this was one stage in their development, in their education. I would see that as, yes, a kind of consistent sort of thread there that, girls give up these dolls. It's a stage on the way to adulthood, as some later Roman writers say, as you pointed out, and that Rufus suggests, yes, they're giving up their games and their toys as well at this life stage. Yeah, absolutely. Thank you so much. It's wonderful.
Thank you. Thank you so much, Lauren.
Thank you, Lauren. Thank you, Chiara. We now have about 15 minutes for questions.
I think Torsten is raising his hand. Yes.
Yes, the sun is shining into my face right now. What about gynecological treatises by Soranus, for example? Is that something you've considered? Because that is, of course, a sign of specialism. So to what extent have you considered that kind of evidence? This is a question specifically for Lauren, I guess, but I'm pretty sure Chiara would like to chime in at some point.
Sure. I think you're absolutely right that Soranus's Gynecology is the specialist treatise of this period, right, that focuses on women's health. And so it's important to put it alongside Rufus's and what Soranus says about the age for healthful first marriage. He says 14, and he goes sort of on to talk about the characteristics of the female body at that age, and I guess through maybe the age bracket of the 20s, 30s, that indicate readiness for childbearing. So there's a focus on feminine appearance, indications of healthfulness presumably for the individual who wants to either ensure a female member of the family is healthful, or for someone seeking a wife who can bear children. Soranus says less. It doesn't offer a diet exercise regimen along these lines, but he is interesting, as some of you may know, he's well known for having a sort of paragraph anyway about how permanent virginity would be the most healthful thing for women. It would be better for all women if they did not marry and have children, because we see how dangerous it is. And then he retreats from that and says, but we know that that can't happen. They really need to assume the risk for for the good of the entire human race, for the propagation of that. So Chiara, I know that you might have something to add there.
Perhaps I just want to say that if I remember correctly, the interval that he suggests is much smaller than the one that we could infer from Rufus. So yeah, this is a contradiction perhaps, because clearly permanent virginity would be the best solution. But on the other hand, if they have to conceive, they don't have to wait for so long. I think the only worry is that the womb might be too small if it's right after the first menarche. But then after that, I don't think that there are as many worries as there can be in Rufus, for instance.
Great,
thank you.
Thank you.
Zoe?
Thank you. It's actually Despina Yoshif, but I cannot seem to change my name. My daughter has tampered with the Zoom, and I'm sorry about that. Thank you for a most interesting talk, Lauren. Would you be kind enough as to tell us why you think that people in antiquity felt overwhelmed when it came with all the choices they had concerning dealing with a health problem? Why do you think that? I haven't read all the Roman sources, of course, but I have read the Roman novels with medicine in mind, and I gathered that people were totally unproblematic when it came to choosing between all the options they had, using chants, incantations, resorting to religious figures, resorting to physicians who had scientific approaches. But of course, I will be happy if you object that Roman novels do not depict reality. And thank you.
Absolutely. Thank you. I was initially prompted to imagine a feeling of overwhelm or sort of chaos, I guess, by reading about the sometimes fairly acrimonious disputes among physicians when they were in the process of diagnosing patients, right? So Galen will sometimes write about how there are multiple physicians at a patient's bedside. They do not agree about the proper course of treatment. Galen sweeps in to save the day. You know, and you know, in his promotional narratives, like on prognosis, we have to imagine that he's telling a story that he wants to shape in a way that's favorable to him. There are also authors like Aelius Aristides in the Sacred Tales, who speaks to how the constant arguments of physicians, the way they couldn't agree over everything, sort of undermined his trust in the profession, led him actually to seek religious pathways for therapy and cure for his ailments in Asclepius cult. And he writes, I think, with some sort of personal experience about how it was just overwhelming for him to hear doctors arguing all the time. So that's sort of, and some of these debates, I mean, as I read more about medical sectarian affiliations and so forth, some of these debates are pretty esoteric and removed from the patient experience. They focus a lot on abstract theory. So that it was sort of my surmising that it could be overwhelming, you know, for patients in the face of what was going on in the medical profession, combined with, you know, this pressure doctors felt to produce novelty in order to gain a following or to gain a clientele. Too much novelty just starts to seem sort of scattered, I would imagine. But that's, yeah, it's a good question.
I have a small comment on your, oh, I'm sorry, Claire, please.
Hi, thanks, Lauren. You raised lots of really interesting points. It was really enjoyable. I'm curious to what degree you think the difference that you articulated between the two texts of Rufus has to do with, to some degree, with genre, right? So we've got, there's an extant genre of texts on keeping well, aimed at people who are not in fact sick, but just want to have kind of a standard regimen. And here, so you have Galen's keeping well is in fact divided, he deals with men, but it's divided by age, right? So teenagers should do this, grown men should do this, as opposed to once you get to sick patients, Galen too, not so much on prognosis, but in his more therapeutic texts, repeatedly says you have to question them, you have to question them, you have to get everything that they know so you can understand what's wrong with them. So I'm wondering, obviously girls are a specific and fascinating subcase, but what degree does genre kind of affect the way that you think about the two texts?
Excellent. Yes, I think genre has a lot to do with it. I mean, the prescriptive texts that are regimen based, even like Galen's exercise with the small ball, right? I mean, those are just sort of general workout regimens, right? It's kind of the equivalent of a workout video or something, right? Like sort of advertising that, and less of diagnosing and treating illness. I suppose the like point of contact between them would be, or what I started thinking about is, girls in the regimen for young girls are treated like they have a problem, right? So in other parts of the text, he says, left to their own devices, and if you intervene too much in other ways, girls will have fevers. They will, kind of experience these symptoms. And so it's interesting, as you're pointing out, that it's not as clear cut as they come into the physician's examining room with a set of symptoms and he diagnoses and treats them. but it's also got the assumption built in that something is wrong with them that needs to be treated, that left alone, they will be sick. And, you know, I'm not entirely sure. And for that reason, it almost falls between the genres, like between something like Medical Questions and something like Galen's Exercise with the Small Ball, which is just about maintaining health. I don't know if that helps, but that's kind of maybe where I would think about it. Yeah.
Okay, I have a small comment on. I find it very interesting your comment on a patient-doctor relationship versus use of medical technology. This is the case with the use of ancient machines or ancient medical machines as well. Of course, not diagnostic machines like in modern days, but I mean, I remember I read somewhere about the invention of the thermometer. It was the instrumentation was giving. I mean, the thermometer was giving different reading of people's temperatures to how they were reporting how they were feeling. So there was a big issue about who do we believe? Do we believe the patient or the thermometer? I think this is very interesting.
That is really, that's an excellent point, right? Which metric, you know, which reporting, as you're saying, do we take into account? Absolutely, that's right at the heart of the medicine and technology lecture series, right?
I think we've got time for one final question because Lauren has another commitment now.
Yes.
Next 5 minutes. So
Carl has a comment. We owe the survival of Rufus' regimen for young girls entirely to the 4th century CE medical writer Oribasius. Oribasius was selective about the texts he copied and frequently made cuts, so his summaries are often subtly different to the originals he was working with. With this in mind, can we say for sure that the text as it comes down to us today is Rufus' original text in its entirety? Could this help explain the differences in Rufus' approaches to the patient in his text and the lengthier medical questions, that is that young girls is a summary of one's longer treatise?
I would say that's possible. I've always thought of the regimen for young girls as being really in dialogue with the Hippocratic treatise, you know, Diseases of Young Girls, as Chiara mentioned before. And they show similarities in some ways, but I think it's completely possible also that something is redacted, you know, taken out of the original text in, you know, the compilation of Oribasius. It's very hard to say. There could have been more in there about speaking to girls as patients. That is always possible.
Okay, thank you very much, Lauren, and thank you very much, Chiara, for your response. We're going to meet in a few weeks to enjoy a talk by Divna on astrology. Thank you very much, all. Bye-bye.
Thank you very much, everyone. Thank you. Chiara, ti